Every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, which is asthma. Good morning again, doctor.
Good morning, Christine.
A lot of people affected by asthma, but first, what exactly is it?
Asthma is reversible spasm of the breathing tubes, which makes it hard to breathe. Accompanied by the spasm is the collection of mucus and inflammatory cells from those breathing tubes that causes mucus plugging and obstruction of those tubes that, again, make it difficult to breathe.
Okay, and 300 million people worldwide affected by asthma.
Right. One report says that 30% of all children worldwide have asthma. And certainly in the United States, where reporting is accurate, 7 to 8% of all adults and children in the United States have asthma. 7 to 8%. 1 in every 250 deaths worldwide is attributed to asthma.
And what are the symptoms of asthma?
3, shortness of breath, chest tightness, and a cough.
Okay, and what triggers it?
Many triggers. Respiratory illnesses, physical exertion, that means exercising, hormonal fluctuations, extreme emotion, and then inhaled allergens, a whole bunch of inhaled allergens. The most important one is probably cigarettes and vaping and cigars. Tobacco is a very important one. In addition to that, wood smoke, strong perfumes and odors, chlorine-based cleaners, mold, dust and mites, pollen, cockroaches, and in Hawaii, Christine, fog is one of them.
How do cockroaches trigger asthma?
Cockroaches have proteins on their body, and also their droppings have proteins in them that cause people to react to them and develop an asthmatic attack.
Okay, and how does it get diagnosed?
Diagnosis is by seeing your doctor, who will get a history and also do a physical examination and then do some respiratory tests. These are not only for diagnosis, but for management long term.
And what are the treatments?
The treatments. There are rescue inhalers like albuterol. This is a rescue inhaler, which I will demonstrate because of my asthma later in this session.
Okay.
And we have long-acting beta agonists, long-acting inhalers that are maintenance drugs, and you're holding one of them right now.
I am. And so when you say maintenance drugs, these are the ones that you take regularly?
Yes.
Okay.
Once or twice a day, and they prevent an excessive number of acute attacks.
And this one just opens up on the side like this.
There you go. Very easy.
Never seen this one. And the one you have, describe the difference between this and this one.
If you have an asthma attack, that won't work.
Okay.
If you have an asthma attack, this one is the kind of rescue inhaler you need.
Okay.
And then, of course, you need to have an active asthma treatment plan, which you've worked out with your family and your doctor, so that, as I say, asthma can kill, so that that kind of serious asthma attack doesn't happen.
And Dr. Brady, you're going to show us how you kind of inhale this. You were diagnosed 10 years ago as an adult, so can you show us what it looks like?
There are 4 steps. One is to shake the inhaler. The second one is to breathe out. The third one is to breathe in while squeezing the inhaler. And the fourth is to hold your breath as long as you can.
And that just kind of opens up the lungs? Is that the feeling?
It opens up those breathing tubes. And there are pills that help with the moderation of the inflammatory response that is part of asthma. Steroids are in those long-acting ones frequently. And then oral steroids are an important part of the rescue of an acute attack.
All right. Thank you so much, Dr. Brady, for being here to talk about asthma. We'll see you back here next Thursday.
Right. Osteoporosis.
Osteoporosis in 1 week. Thank you so much.